I'm Michael Herbaut. I've had I have severe degeneration of my cervical spine with osteoarthritis, and was unable to get a timely operation carried out in the UK back in November last year. That will be 2022. The pain was so bad that I was very bad mentally. And so I contacted bookinghealth.com, and within 2 days I had a date, and within 6 weeks, I think, the operation was completed, and very good too. I needed it. In the UK at the moment, due to lots of reasons, but the main reason is historically cutbacks in the expenditure on the National Health Service, that before pandemic, there was something like 3.5 million backlogged. And that was already causing problems with the NHS during the winter period. So if you look at my history, then obviously I needed help during the winter period. Historically, the NHS has been overloaded every winter now for, well before the pandemic. They were showing signs of strain and not able to cope. After the pandemic, the backlog of what they call elective surgery, that surgery where you decide to have it done rather than accident or emergency. That's the way we distinguish that in the UK. It's called elective surgery. Elective surgery was basically discontinued, very much so, during the whole period of the pandemic. So we came out of the pandemic with roughly 6.5 million people waiting for elective surgery. Of course, I then hit that peak and was unable to get that done. The current elective surgery waiting list is now 8 million people are now waiting for elective surgery. Now that includes minor surgery procedures that might be day patients or something like that, right the way through to hip replacements. I don't think cardio surgery is so bad, and certainly cancer surgery is highlighted as being as best as they can do it within a month. Whereas really anything else, elective surgery, you could be waiting 2 years for 2 years plus for a hip. It seems to be the situation here is that if you can walk, then you're not considered urgent. That's about it. And because I could walk and talk and I was still around and able to do what today, I was nowhere on the list of being done for my surgery, nowhere near it. And I withdrew all my life savings, and we went ahead with the procedure in Germany, which is a big step forward. Quite scary at the time. Yes, you can have your operation, but we haven't got a bed for you. That's a common experience in the UK. Very common. You go forward for elective surgery. I've had it happen to me as well. Just twice gone forward for elective surgery. You get all your pipes and tubes put in, and then the doctor brings around the curtain. He says, "I'm sorry, we haven't got a bed for you. You've got to go home." It's happening daily. People being 2 or 3 times before they actually get the surgery carried out. My friend's father, he was quite frail. He waited 3 times for elective surgery on an aneurysm in his aorta, and he died the day before he was supposed to go in again for his. So that's the real impact of having those elective surgeries keep getting put back because they don't have a bed. But yes, it can happen, and it does happen, and it's happening daily now. It comes on the television every now and again, but not a good place to be if you want surgery. I can tell you that. You can get most other things done, pills. You get pills as easy as you like, but from the doctors. But surgery is a completely different thing. And now the private sector here is becoming overloaded because so many people are saying, "Well, hang on, how much is it going to cost for a hip? Oh, 10,000 quid." Okay, that's say about at €10,000 for a hip. Okay, I'll pay £10,000 to get my hip done. So they're going into the private sector. Yeah. And I had my hip done privately, but that was 5 years ago. But once again, I used the NHS, but that's because I was told I'd have to wait 18 months to 2 years, and I was having problems walking then, but I could still walk. You see, there's the criteria. Can you walk? Then you're fine. Is it painful? Oh, we'll give you some pills. Exactly how it's working at the moment, and there's lots and lots of people now moving into the private sector, scraping money together to go into the private sector. Excellent, absolutely first class. I couldn't believe, because even when you get admitted in the hospitals in the UK, there is a lot of waiting about for test results and things like that, or going through for further examinations. When Professor Meyer said he wanted to do a quick test on one of the joints on the back of my neck, I thought, oh crikey, that's a week's delay, bearing in mind what we take here. And within 2 hours it was done and he had the results. So you can't compare the two animals. I'm sure there are some people within the NHS who get that sort of service, but it's not general. Generally you wait and wait and wait. So you get your test, whatever the test gets carried out, then you wait a fortnight to a month to then get back to see the surgeon to then discuss what those results were. And that's really, so the main delay is if you will see a consultant 1 month, you will have to wait at least 3 months before you will see him again. That's the state. That's a general state. But the NHS has been in that position for a considerable amount of time, even before the pandemic. So we're really not in a very good shape over here. So that's so yes, the service you couldn't fault. I couldn't believe how fast things were done, and even when there were some minor delays that cropped up, I was still back on the program within a few days, and the work was carried out beautifully, excellent. I was glad to wake up though. Surgery that I was being offered was obviously the same thing, one single disc replacement at C5, C6. That was going to be done by general surgery. I was warned that I might not be able to drink and eat for several weeks. I was told I might never recover my voice fully, because they do a much more intrusive surgery in the UK. And so I was surprised that the system in Germany was a robotic assisted system. I didn't get to see it because as an engineer, I would have loved to have seen it, but I didn't get to see the aforesaid robot. I would love to have seen the system and seen how it worked, but it was minimal. The scar is here, fully healed. In the UK, they go that direction, and it's a much bigger intrusion. So they have to move an awful lot of the internal structures, your windpipe, your vocal system over to one side, and that's where the damage can occur, and generally does. I could not believe that I was awake and I had food and I could speak the next day, having been told that I might not speak for months properly in the UK, and I might not be able to eat. I was told I might not be able to eat anything more than soup for 2 to 3 months, and I was eating sandwiches the next day. How can you compare that end result? It's Star Trek away from the reality, isn't it? It's so far away from what I was told I was going to have to suffer through. So we weren't going into the surgery lightly, even in the UK or Germany. But the reason I picked Germany was because you've been in the press many years ago with your exceedingly good spine surgery techniques. So that's why I picked Germany, and that's why I started from there. Searched the web in desperation to get treatment. So that's a big difference, and it's very streamlined in Germany. We were wheeled around with Oksana Cook's help we wheeled around in different departments, and it just happened incredibly quickly. And all the pre-op and stuff like that. Mind you, I did bring an awful lot of information with me. I was anticipating some of the questions that would need to be asked, particularly from the anaesthetist, because I've got heart disease and lots of complications. But all that was brought with me, and it was accepted, and so away we went. And I'm glad to be here to be able to talk to you. Straight search surgery in Germany, and I think your name was one of the first that came straight up on the search engine, and I went from there. To be fair, I didn't look any further. Once I'd found that there was a company that could, you can imagine it's scary from this end because you don't know how to put that package together. You know, which hospital would you pick? No idea. Wouldn't have a clue. You know, which one would you pick? So I sent in my details to, there was a lady much like yourself at the front end. And as I say, within 2 days, she came back with quite a high cost, which was, I think, about 55,000 euros. And I said, oh, I just do not have that money. So she said, no matter. She said, fill the form in, we'll send it back and we'll see which hospital with the right expertise could take you on. So what more could you ask for? Because how would you know how to do that sitting in the UK? How would you know which hospital to ask who could do that work? You wouldn't know. It's a complete unknown entity. So that was set up, as I say, within I think the first date I was given when I made the first introduction was the 17th of April, and then that moved, because by the time everything had got in place, that moved then to the 23rd of April, and then a small delay, and then it was done. It was actually operated on the 2nd of May. It's all within days, actually, if you think about it. You know, from the day of pressing the button that says yes, let's do it. It was less than a month. Michael Schmidt was the project coordinator for me, but there was actually a lady at the front of that whose name I don't have in front of me, but she was handling all of the preliminary information and payments and stuff like that. So I was paid through that, and then they got handed over to Michael Schmidt. But Michael Schmidt was constantly phoning to make sure that everything was all right. Was I okay? Was everything going okay? Did I need anything? Michael Schmidt was doing the administration side and keeping all the bits going in the hospital, but Oksana was my day-to-day support, and that couldn't have been any better. The surgeon didn't know it at the time, although we did look him up to see what, because you can imagine from where we were sitting, we'd never been to Germany before, and we'd never met that surgeon before, but we looked him up, saw all his qualifications, saw where he worked, but I didn't realize how senior he was until we went there. And he's winning awards not just for Germany but Europe-wide. So absolutely the right person for me. You know, you think, wow, that was, yeah, brilliant, absolutely superb. Yeah. During the consultation with Professor Meyer, just out of the blue, he said, you've got similar deterioration in the joint above. He said, I'll do that at the same time. It was conversation closed. He said, so he was doing 2 instead of 1, and I was only being offered 1 in the UK. So I was actually given twice the amount of surgery, because he said, well, while I'm there, you know, everything's open. He said, oh, I'll do that one while I'm passing. You think, I could not believe that, because that saved me. That if that joint was also deteriorating, I could have 1 done here in the UK, and in perhaps 2 or 3 years' time, I would need another 1 done. And at my age, with my heart disease, surgery of that nature is very risky for me. I might not come off the table because I'm so old. And you're getting a general anaesthetic, and you could be under for 4 or 5 hours. So that's not good for me. So I would have had to suffer all of that again to have the next one up done, possibly. You think, wow, that was, talk about a surprise. So I thought, well, that's it, because I was, just to let you know, I was being charged about 15,000 UK pounds, say 15,000 euros for the one joint to be replaced. So if I had to go back again, I would have spent the same amount of money, because I would have to spend another 15,000 to have the next one done. And yet, with all the recovery time required after the UK surgery, at least three to 4 months before I would be able to be eating, drinking, and back to normal here. Whereas it was within a month having the work done here. And the facilities in the hospital couldn't fault. Everything was clean and tidy. The food was a bit monotonous because I don't eat a lot of cheese. There's a lot of cheese, a lot of cheese all day long, and I don't eat a lot of cheese. Well, I don't eat any cheese actually. So it was mainly bread and jam for me until the main courses came, but that was fine. So food was fine. Should I have needed further surgery and I could afford it, I wouldn't hesitate. No hesitation at all in coming back particularly to that surgery, so that surgeon and that hospital. I wouldn't have any hesitation at all in coming back to have further work done. Not at all. Not at all. No. I wish they could do the problem I've got with the nerves at the back of my neck, but I'm sure they could do that, because they did a similar exercise on this side as an experiment to see whether it was that nerve was causing a problem. But I'm afraid I can't afford to come back. Otherwise, I would not be sitting here waiting for this elective surgery to. Well, it's pain management now, they call it. So I'm going into a different clinic, and because I'm going into a different clinic, it's 272 days waiting time before they'll give me a telephone conversation. So I've got to wait till about this time next year, because before they'll do any further, it won't be surgery, but it'll be nerve control on the neck. So I've got to wait another year. And I'm sure if I went to Germany, it would be done within the month and I'd be home. After recovery, the main reason for having those discs replaced was because the disc had collapsed, and there's nerves that run through that area that control the nerve signals to your arms. I'm not sure how. The pain was so bad that I would be spending up to 12 to 20 hours. I don't know if you're ready for this. Screaming with pain on the floor. That's how bad it was. Yeah, that's exactly bad. So every time I got a migraine, and that was being exacerbated by the nerve system, I got in touch with a professor in London who was an expert on cervical spine degeneration and headaches. And he said, without a doubt, that's the first thing that's got to be tackled, is to get that joint fused and lift those bones up a bit, to give the nerves around that area time, ability to move and not be. I was ever being crushed by my own weight and neck. Since then, the migraine still hasn't stopped, but we are working along a different area now with pain management, heavy use of pain reduction chemicals, pills. It's not gone, but it never would. It was always very unlikely that it would be sufficient to stop it, because of the degeneration with the arthritis. The bones in my neck are just are unbelievable to see. I think I sent the CT scan to Michael, so that was sent on into to the surgeon at Munich. So he'd have seen that, and so they made their decision from that as well. Plus the MRIs that I'd sent. I paid all for those things. So yeah. So yes, no, we're still got another year of waiting to try and stop the migraines, but whether they ever really ever go is conjecture. We don't know yet, but it would be nice if they got. It would be nice if they got better, but they are still troubling me. I'm getting a migraine really every day, but I'm not on the floor screaming anymore. So yes, no, that was horrendous. We had about a year of that before I came to Germany. So you can see I'd run out of resilience. I just didn't have anything left in me to keep coping with the really bad pain and disability, because I couldn't go anywhere. It was awful. But there are some very slight changes in the last few weeks that looks like something is settling down. Because obviously when you do surgery like that, all the nerves in that area have got to recover and relax from the crushing. And nerves take a long time to regenerate or never regenerate. Nerves are that's why people get spinal. They cut your spinal cord, you don't walk. And that's why people become totally incapacitated, paraplegic. So, but no, it's we're a long way along the line now from getting that sort of screaming pain. And I was in hours and hours and hours of it. Very, very bad. Yeah, big difference now. I'm fine. Well, I think it would apply to hip replacement. There's a huge waiting list in the UK for hip replacement. I don't know about the waiting time for neck, because it's not, they don't publish those figures, but they do regularly talk about hip replacements and knee replacements. People waiting 2 years plus for hip and knee replacements, and shoulder as well. And my shoulder is also arthritic, but I can put up with that. The arthritis really runs right the way across from the shoulder, in the shoulder joint, right the way across to the neck joint in there and into the neck itself. So the arthritis is pretty complete on that side, but much worse on my right. And being right-handed, it is a bit of a disability. So this hand has got to have a lot more training. I'm trying to do more with my left hand because it's I can't lift. But hopefully, if we can get these nerves treated on the back of the neck, that would be good. But I'm sure there's huge amount of pent up need in the UK for people to come with reliable resources like you were able to provide for me into Germany and have the work done, no matter what it is. I'm sure there's all sorts of surgery that could be taken on. The only thing I would put out is that for people considering it, there are some flight restrictions that became apparent, like for major surgery like I had. I couldn't go home until I had, I think it was 10 days post-operative, but that worked. So we just stayed in the hotel for the period of time that was needed, and that was fine. So, but yeah, obviously those costs mount up a bit. I've great confidence in Professor Meyer, because he's a neurosurgeon, isn't he? He's not just a spine surgeon. He's the full works. He does neuro work as well. He's brilliant lad, brilliant. Yeah, I told him he saved my life, and he didn't believe me, but he has.